Pompe disease is a rare, life-threatening disorder that is caused by mutations in one gene that encodes the lysosomal enzyme acid alpha-glucosidase, or GAA, and is inherited in an autosomal recessive pattern. GAA works to metabolize glycogen stored in lysosomes. Muscle cells specialize in storing glycogen, so skeletal, smooth, and cardiac muscle tissue are all vulnerable, with respiratory and skeletal muscle being particularly affected. Without functional GAA, glycogen accumulates, causing lysosomes to expand and destroy muscle cells. Pompe disease has a heterogeneous presentation on a spectrum based on the amount of functional GAA produced, varying from the severe, rapidly progressive IOPD, which often results in early childhood death, to LOPD, which can manifest at any time in childhood or adulthood and results in progressive ambulatory and respiratory failure. Diagnosis may be challenging due to similarities with other neuromuscular disorders. LOPD diagnosis is usually based on elevated markers of muscle damage and confirmed by measuring GAA activity and sequencing the gene. The diaphragm and intercostal muscles are the most prominently affected, resulting in a progressive decline of respiratory function. Up to 50% of Pompe disease patients require ventilator support, and respiratory failure is the leading cause of death in LOPD patients. Patients at all ages often experience progressive skeletal muscle weakness, resulting in the need for walking aids, including wheelchairs. And across all ages and severities of disease, patients are plagued by debilitating fatigue that interferes with activities of daily living. Existing treatments have improved clinical outcomes for patients, including motor and respiratory function, quality of life, and survival. However, limited uptake by muscle cells and potential immune reaction to exogenous GAA may limit response to treatment, so patients may benefit from the expression of GAA directly in muscle cells. New therapies are currently in development to potentially address some of the treatment needs of patients with Pompe disease.